Women with large breasts experience more than dissatisfaction with body image. Breast size may impair a woman's ability to lead an active lifestyle and may cause physical discomfort and pain. The emotional discomfort and self-consciousness often associated with having large pendulous breasts can be as important an issue as the physical discomfort and pain. Breast reduction is plastic surgery to reduce breast size and enhance breast shape and position, giving you a breast size proportional to your body and alleviating the physical discomfort associated with large pendulous breasts. This program presents an overview of breast reduction. It is not a substitute for complete consultation with a plastic surgeon certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Good candidates for breast reduction are healthy women who do not have life-threatening illnesses or medical conditions that can impair healing. Breast reduction surgery is generally performed at an age when the breasts are fully developed. If it is performed at an age before the breasts are fully developed, the outcomes can change. Breast reduction can benefit women who are uncomfortable with their breast size, experience back, neck, and shoulder pain, have shoulder indentations from bra straps, experience skin irritation in the breast crease, or suffer limited physical activity due to breast size. A consultation with a board-certified plastic surgeon and member of the American Society of Plastic Surgeons is the first step to learn how breast reduction can alleviate the physical symptoms of overly large breasts and improve your body image. A consultation is designed to fully educate you about breast reduction with a discussion of your goals, the options available in breast reduction surgery, the likely outcomes of breast reduction surgery, and potential risks and complications. Your surgeon will also describe the course of treatment recommended for you and answer your questions. During a consultation, you'll be asked to share your personal health history. Full disclosure of your health history is important to your safety. This includes any history of breast cancer in your family and your personal breast health. You must also be candid about current medications you may be taking, the use of vitamins and herbal supplements, and alcohol, tobacco, and drug use. Your surgeon may ask that you get a preliminary blood test and take certain medications or adjust your current medications. You will also be asked to stop smoking and avoid taking aspirin and certain anti-inflammatory drugs as they can increase bleeding. Your plastic surgeon will also examine and measure your breasts, including detailed measurements of their size and shape, skin quality, and placement of your nipples and areolas. Photographs may also be taken to document your breast's appearance. A mammogram may be recommended prior to and following your procedure to ensure breast health and serve as a baseline for future comparison. By making the decision to consult with a board-certified plastic surgeon and following all of the instructions you were given, you are taking an important step to helping ensure your safety. A board-certified plastic surgeon is a physician who is specifically trained in plastic surgery of the face and entire body. Breast reduction is generally performed on an outpatient basis, in an office-based surgical facility, an ambulatory surgical center, or hospital setting. Members of the American Society of Plastic Surgeons are required to use only accredited surgical facilities. Breast reduction involves making incisions on the breast skin to remove excess breast tissue and skin. Liposuction techniques may be used in conjunction with incision techniques to reduce breast size. In cases where breast size is largely due to fatty tissue and excess skin is not a factor, liposuction alone may be used for breast reduction. The technique used to reduce the size of your breasts will be determined by your individual anatomy, breast composition, amount of reduction desired, your personal preferences, and the surgeon's recommendation. Medications are administered for your comfort during the surgical procedure. The choices include intravenous sedation and general anesthesia. Your doctor will recommend the best choice for you. Incision patterns vary based on the amount of tissue and skin to be removed, the quality of skin elasticity, patient anatomy, and patient and surgeon preference. A keyhole incision pattern is one of the techniques for breast reduction. It begins with an incision around the areola, continuing vertically down to the breast crease, then horizontally near the breast crease. Through the incision, excess fat and tissue is removed, the areola diameter is reduced, and the nipple is repositioned. The nipple generally remains tethered to its original blood and nerve supply when repositioned. Rarely, in some extreme cases, the nipple and areola may need to be removed and transplanted to a higher position on the breast, in a procedure called free nipple graft. The underlying breast tissue is then reduced, and the remaining breast tissue is then lifted and shaped. Sutures are layered deep within the breast tissue to create support for the newly shaped breast, and the incisions are brought together to reshape the now smaller breast using sutures, skin adhesives, and/or surgical tape. The decision to have breast reduction surgery is extremely personal. You will have to decide if the risks and potential complications are acceptable. In general, complications from plastic surgery of the breast include bleeding, poor healing at the incision sites, changes in nipple sensation, infection, and dissatisfaction with post-operative breast size. Breast reduction surgery may interfere with a woman's future ability to breastfeed. If you're planning a pregnancy, you may wish to postpone your breast reduction. It is important that you discuss all of your questions directly with your plastic surgeon. Prior to your procedure, you will be asked to sign informed consent documents. These documents assure your plastic surgeon that you fully understand the procedure you will undergo and potential risks and complications. Immediately following your surgery, dressings or bandages may be applied to your incisions, and an elastic bandage or support bra will minimize swelling and support the breasts as they heal. A small thin tube may be temporarily placed under the skin to drain any excess fluid that may collect. Before being released, you and an accompanying family member, friend, or caregiver will be given specific instructions that may include how to care for the breast following surgery, medications to apply or take orally to aid healing and reduce the risk of an infection, specific changes to watch for at the surgical site or in overall health, and when to follow up with your plastic surgeon. Following your physician's post-operation instructions is essential to the success of your surgery. It's important that the surgical incisions are not subjected to excessive force, swelling, abrasion, or motion during the time of healing. Be sure to ask your plastic surgeon specific questions about what you can expect during your individual recovery period. The results of your breast reduction surgery are immediately visible. Satisfaction with your new image should continue to grow as you recover from surgery. Over time, post-surgical swelling will resolve and incision lines, although permanent, will fade. The final results of your breast reduction will appear over the next few months as breast shape and position continue to settle. The results will be long-lasting, but over time, your breasts will continue to change due to aging and gravity. You'll be able to retain your new look longer if you maintain a stable weight and a healthy lifestyle. Many insurance plans cover breast reduction surgery. Your plastic surgeon may need to obtain authorization from your insurer prior to surgery. The cost of the surgery may be based on the surgeon's experience, the type of procedure used, and geographic location. Be sure to ask your plastic surgeon what patient financing plans they offer. Costs for breast reduction surgery include anesthesia fees, hospital and surgical facility costs, medical tests, prescriptions, and surgeon fees. When choosing a plastic surgeon, remember that the surgeon's experience and your comfort with him or her are just as important as the final cost of the surgery. The American Society of Plastic Surgeons has prepared this educational program to supplement your personal consultation with a plastic surgeon who is certified by the American Board of Plastic Surgery or the Royal College of Physicians and Surgeons of Canada. Plastic surgeons with this certification have completed approved surgical training and rigorous examinations in plastic surgery, including both cosmetic and reconstructive procedures of the face and entire body.